the examination and drug administration and sample collection in calves. So for the examination of calves, look at the general condition, dehydration, appetite, and look at the navel as well. Look at the notifiable signs and look at the basic clinical values. In calves, the temperature is from 39 to 40 degrees. However, in cattle, in the adults, it's a little bit less. It's 38.5 to 39.5 degrees Celsius, so it's 0.5 less. For the heart rate, in calves, it's 100 to 120 beats per minute. However, in the adults, it's 60 to 80 beats per minute. And for the respiratory rate, it's 20 to 40 beats per minute. However, in the adults, it's 15 to 30 beats per minute. And in both the calves and the adult cattle, the capillary refill time is less than 2 seconds. So when checking the calves, check the hair, the skin, the lymph nodes. Check the mucous membrane of the mouth and the conjunctiva. And for the respiratory, check the auscultation of the chest, trachea and larynx. And for circulation, check the auscultation of the heart and the capillary refill time. And for the gastrointestinal tract, check if there's diarrhea and check the palpation, the fullness of the stomach. You can also test things like their urinary system, the locomotor, and the nervous system. And you can do blood tests for immunoglobulin levels, as well as the herd level blood collection. And for feces, you can do parasitology and quick tests. For drug administration, you can give things per os, subcutaneous, intramuscular, and IV. For per os, you can give colostrum, probiotics, vitamins, and drugs, as well as mix with milk and using a drenching gun and using a syringe. For subcutaneous drugs, you can give drugs, vitamins, and fluids if IV fails, and you can also give it in the neck in the upper third and have a sharp angle to the skin. For an intramuscular injection, you can give drugs, vitamins, trace elements, and it has to be cranial to the scapula. So give it in the upper third of the neck, perpendicular to the skin, and do it fast. And for IV drugs, you can give drugs, infusions, and you do it in the jugular vein at a caudal angle. And for sampling, you can check the blood using the jugular vein, have a cranial angle for sampling. For checking the feces, they need to be fresh feces, and it's best if they come from the rectum. And for sampling the hair and skin, you can do ear tagging for bovine viral diarrhea, as well as skin scraping for ectoparasites. However, this is rare. And for urine sampling, it's not really done in calves. It's rare and not reliable. You have to do free catch or use a catheter.